The NCLEX exam will test your ability to distinguish between HIV infection and a diagnosis of acquired immunodeficiency syndrome or AIDS. This distinction is not based on symptoms alone, but on a specific laboratory value and clinical condition. The key number you must remember is a CD4 T cell count of less than 200 cells per cubic millimeter. A patient with a CD4 count of 250 is HIV positive, but a patient with a count of 199 has progressed to AIDS. The other critical diagnostic criterion is the presence of an AIDS-defining opportunistic infection, such as Pneumocystis jirovecii pneumonia or Kaposi sarcoma, regardless of the CD4 count. An exam question might give you a patient's CD4 count and ask for the priority nursing action. If the count is above 200, the priority might be medication adherence education. If it's below 200, the priority shifts to monitoring for and preventing opportunistic infections. You will also be tested on the relationship between CD4 count and viral load. In effective antiretroviral therapy, or ART, the viral load should be low or undetectable, and the CD4 count should be high. An exam question might present a scenario where a patient's viral load is increasing and their CD4 count is decreasing. This indicates treatment failure, and the most likely cause, from an NCLEX perspective, is non-adherence to the medication regimen. The exam will not ask you to memorize dozens of ART drug names, but it will expect you to understand that strict, lifelong adherence is non-negotiable to prevent the virus from developing drug resistance. A common trap is a question asking for the nurse's best response to a patient who admits to frequently missing doses. The correct action is to explore the reasons for non-adherence, such as side effects, cost, or complex schedules, and provide education on the critical importance of their regimen. Understanding transmission and prevention is essential. The virus is transmitted through specific bodily fluids like blood, semen, vaginal secretions, and breast milk. The NCLEX will test your ability to educate patients on prevention, such as consistent condom use. It will also test your knowledge of standard precautions, which should be used with all patients regardless of their HIV status. Expect questions designed to trap you into selecting incorrect transmission routes. HIV is not spread through casual contact like hugging, sharing utensils, or toilet seats. A question might ask which statement by a patient's family member indicates a need for further teaching, and the incorrect statement will involve one of these myths. For healthcare workers, the priority after a needle stick injury is immediate post-exposure prophylaxis. As a simple way to remember the critical diagnostic point, think of this phrase, below 200, troubles brewin'. This is your mental shortcut to link a CD4 count under 200 directly with the high risk of opportunistic infections that define AIDS and require immediate, focused nursing vigilance. This single number is one of the most frequently tested concepts related to this topic.